Well, good morning, everybody. It's 11 o'clock, so we're going to get started. Welcome. This is the Ask the Doctor Q&A hosted by the Chicago Lighthouse. My name is Dr. Kelly Scherer, and I'm a low vision optometrist at the Chicago Lighthouse. I'm co-hosting this session with Mary Abramson. And for those of you who are not familiar with the Chicago Lighthouse, we are a social service agency serving the blind, visually impaired, disabled, and veteran communities through programs in low vision rehab, education, employment, and independent living. For today's session, you're welcome to put your questions in the chat, or you can raise your hand and our moderator, Jessica, will call on you. Please remember that all participants are currently muted, so you will have to unmute yourself when you're called on. You can enable captions by clicking the closed caption button at the bottom menu bar. And please feel free, if you're having any accessibility issues, to let us know as well. I'm going to let Mary go ahead and get started, as long as everybody's okay and can hear us.
Thank you, Dr. Scherer, for answering our questions today. So one of the biggest questions we have is most people see an eye care professional on a regular basis. What is the difference between low vision optometry and seeing their ophthalmologist or optometrist?
Great. Yeah, I'm happy to answer that. We take a different but a really complementary approach to what managing eye doctor typically does. We focus much more on function as a result of the disease, whereas your doctor might be focusing more on treatment and management of the disease. And so just to explain what that means, the focus of our exam on function includes, like, when we first meet our clients, we want to take a functional history. And so we talk to you quite a bit about, like, your day-to-day tasks, what your lifestyle is like, what you're having difficulty with, but also like what your support system is like and what your daily demands are in terms of like transportation, employment, hobbies, goals. Then we take a functional evaluation. So we look at not only just like how well you can read on the chart, but also like how large your side vision extends to, how much contrast sensitivity you can decipher, what your color vision is like, how you respond to different lighting environments, and how you operate with your visual perception. Then we move on and we evaluate devices and tools. And we also spend a large part of our exam on education. So we believe that it's really important that our clients understand their diagnoses to be good healthcare advocates for themselves and understanding their disease and treatment options. So that's kind of the overall philosophy of what we do in low vision rehab. I'm going to open it up to our audience. If anybody has questions, again, feel free to type them in the chat and we'll read them aloud, or raise your hand and we will call on you. If we don't have any questions at the moment, we can move on to some other questions that Mary might have for us.
Yes. So how does one know that they need a low vision exam? Is this something that their regular eye doctor is going to let them know about?
Often our patients are referred by their eye doctor, but I always believe that the individual is the best person to determine when they need our services. It's not always a specific time in the disease or a specific level of impairment that warrants a low vision exam. I really believe that it's when somebody starts to struggle with their day-to-day function and their vision is limiting them in some way, that it's a good time to come and see us, so that we can find a solution for them. So that can be as early as like when you first get the diagnosis, and it can be, as late as like I've had this for 20 years, but maybe something in my life has changed, like I moved or my support system changed. We see people from mild to total vision loss and low vision. So there's no wrong time to come for a consultation, and you can self-refer to low vision providers.
I see. How does one find a low vision provider?
So there's a couple different resources I would suggest. Vision Service Alliance has a website called whatislowvision.org, and they have a directory that you can type in your state or your zip code. They have a list of people practicing low vision. You can also, if you are working age, find a state vocational rehab agency that should be very familiar with the low vision services in the area. They are categorized by state at rsa.ed.gov. And then the third place I would suggest is Prevent Blindness. They're at preventblindness.org. They have a list of low vision resources as well, state by state.
Okay, thank you. So typically, will medical insurance pay for these low vision services?
Yes. So most often our patients are coming to see us on their medical insurance, and it typically covers the service. It usually does not cover, unfortunately, low vision devices and tools. So typically those are covered by the patient or by assistive funding.
I see. So I've had low vision all my life, and I know I'm one of these people that I've already tried a million different eyeglass prescriptions and over-the-counter magnifiers and other devices, and nothing seemed to help a whole lot. Would I, when I was younger, have really benefited from a low vision exam?
Yes, we recommend that even if like what you've tried before hasn't really worked, that it still might be valuable to see a low vision doctor. A lot of low vision devices are regulated, and so what you can find over the counter isn't as strong as what we have in the office. And we also take quite a personalized approach. So sometimes we are finding tools based on the specific demand or goal that the client has. We also do quite a bit of resourcing for clients. So even if there isn't necessarily an optical solution, maybe there's an adaptation or a way that we could teach you to do it in a different way. So we provide all different types of rehabilitation care in addition to just devices.
I see. What kind of devices and adaptive technology do you prescribe? What are the most popular ones?
So I always start with the most basic thing of glasses. A lot of my patients still wear glasses. We do prescribe a lot of high-powered reading glasses in low vision. We do often prescribe magnifiers. Those can be in the form of like optical magnifiers, like a handheld traditional magnifier, or in the form of electronic magnification. So we do a lot of like closed circuit televisions and electronic magnifiers. We also do quite a few distance devices. So we will prescribe telescopes or distance magnification, which can be in the form of things that would be attached to glasses, like a bioptic telescope. We prescribe those frequently for driving, or like monocular telescopes that you would hold in your hand, similar to binoculars. And then we do a lot of non-optical aids too, like lighting and like tints and filters. We do some tactile labeling. We do a lot of writing tools and audio tools. And then we also work in partnership with assistive technology. And they dive quite a bit more into electronic magnification, text-to-speech, Braille products, and screen readers.
I see. So, how, how can I connect with other low vision patients? Because I know that connecting is powerful for networking and that support element.
Yeah, absolutely. There are quite a few programs nationwide that are available if you're looking to connect with other individuals living with vision loss. The National Federation of the Blind, NFB, has state affiliates. So if you go to their website, nfb.org, you can find a state affiliate. The Foundation Fighting Blindness also has local chapters that are regional. If you're interested in joining theirs, they are fightingblindness.org. The organization Hadley has telephone discussion groups. If you'd like to join something from home, they're available at hadley.edu. There is a peer support group by phone called Eye to Eye Peer Support program for vision loss, and you can call them, and they have support groups and different individualized support for living with vision loss. Their phone line is 833-932-3931. And the last one I wanted to mention is an organization called COVIA, C-O-V-I-A. They have a program called Well Connected that offers telephone-based programming for seniors, and they have specific support groups related to vision loss as well. And they are available at COVIA, COVIA.org, or at 877-797-7299. And so like if you find a low vision agency locally, they typically also have programs to meet other people, including the Lighthouse. And so asking your low vision doctor or asking your retina doctor is also, or ophthalmologist is another great place to look.
Wow, there really is a lot out there. Thank you. So is there also a lot of ways of finding the newest research and technology concerning eye diseases and blindness?
Yeah, absolutely. I get this question a lot. And some of the places I recommend people take a look, beyond talking to your doctor, your doctor is a great place to start because they know exactly what your disease is. And so they're usually familiar with what might be available in terms of clinical research or new medications or treatments. If you're not getting the information you're looking for from that source, I do suggest people call the Foundation Fighting Blindness. They are a large funder of vision research, and they do a lot of public education about the research in the field of vision loss and blindness. And again, they're at fightingblindness.org, or you can call them on the phone at 1-800-683-5555. You also are welcome to join. We have a clinical trial that we are currently recruiting for through the Chicago Lighthouse. That's an intracortical visual prosthesis. That is an implant for people with total vision loss. And they're doing an info session at noon following this session on the Chicago Lighthouse page at the Blind Health Expo.
Nice. So I struggled as a child in school. So is there anything available to help children keep pace with the level of learning as their classmates these days?
Yes, there's quite a few support systems in place for children with vision loss, starting at birth. If we identify the vision loss that early, there are programs called early intervention or individual family service plan. So you'll hear it as EI or IFSP. These are programs for infants with disabilities up to age 3, and they're community-based therapy programs to help encourage the child's development and meeting their milestones prior to the entry into school if they're living with a disability. We view this as particularly important with vision impairment, as children's development is very visual. So often the parents are not as familiar with how to substitute that learning to the extent that the child would need it. And so early intervention can be very supportive in that aspect. When the child gets into school, children in the public school system are eligible for vision services with one-to-one with a teacher of the visually impaired. This is through an individualized education plan. So any child over the age of 3 up to age 22 is eligible for that type of support. That support includes individualized training with a teacher of the visually impaired, but it also includes their accessible learning materials and the accommodations that they might need for the classroom. If you are looking for support for a child, you can contact your local Department of Human Services to receive early intervention information. DHS has a website that's dhs.state your state abbreviation.us. Another really good website is familyconnect.org. They have a lot of resources for parents of children with vision impairment. There's also a national organization called National Association for Parents of Children with Vision Impairments. They're napvi.org. There's also a specific office of early childhood education in your school district. So you can call the district to ask for support in that aspect as well.
Wow, I think we've come a long way with finding services for children and adults who have low vision.
Yeah, absolutely. There's lots out there. It's just kind of getting connected to what you need and what people are looking for. Do we have any additional questions from the audience that we could answer, myself or Mary? I don't see any other questions in the chat right now, Mary. I can kind of speak a little bit more to what I do if people are just kind of here to listen and learn about what we do at the Lighthouse. I want to speak a little bit more broadly to what we do as low vision optometrists on a team-based approach. So in low vision optometry, we work with a lot of different providers as an interdisciplinary team to serve the client. And so typically when a client comes in for an appointment, they start with the optometrist so that we can assess their level of vision impairment and understand what they need and also what they would qualify for. And then we help to assess what other services would be advantageous to them. And so I can kind of walk through what other services are available through us, but also what you would typically find in a low vision model. So if you are coming from, say, your ophthalmologist, you don't know what low vision optometry is, you're usually going to have kind of like a more functional evaluation with a lot of questions about what your level of function is and what your day-to-day is like. And then we're going to measure the vision in a lot of different ways and show you tools and devices basically to help out. Then I typically will talk to people about like their adjustment and their coping with their vision loss. So how they're dealing with it, what their support system is like. If they feel they like more support, we offer psychological services at the Lighthouse in the form of one-on-one counseling. And we also have support groups. And like we said, you can find support groups on the telephone all nationwide and remote. We also talk to our clients about like how they're doing with their mobility. So we try to identify if patients have mobility needs, they're having difficulty getting around, navigating, and if we can support them through orientation and mobility instruction, or if they have had O&M in the past, help them to understand that O&M is doesn't have to be a one-time training. You can always do a refresher of O&M. Sometimes your mobility demands change with time, depending on what your lifestyle is. We also talk about like day-to-day skills and tasks. And that is for the purpose of understanding whether or not the patient would benefit from working with an occupational therapist. Our occupational therapists in low vision rehab are very subspecialized in adaptations related to vision loss. So a lot of my clients say, oh, I've had OT before, but I try to explain that low vision OT is a little bit different when we're focusing really on visual adaptations. So learning to live with the vision loss in the most independent way that you'd like to, and learning to be more efficient with certain tasks, or or more independent with certain tasks. So they work on device training and visual training and just functional adaptations to living with vision loss. And then I also mentioned we also work with assistive technology specialists. So again, you'll find these in lots of low vision models. They are specifically trained in teaching people the accessibility features on personal technology like phones and computers. They also typically train people on separate devices like CCTVs, text-to-speech devices like OCRs, combinations of those. And then they also work on like Braille equipment, so refreshable Braille displays or other pieces of assistive technology. The last service that I most commonly work with is we work with employment counselors as well at the Lighthouse, and a lot of low vision providers can help connect you to a low vision counselor, to an employment counselor. So if you are seeking employment, a low vision provider can support you in that as well. The Chicago Lighthouse has employment counselors at our facility, but each state also has employment counselors that are available for people with disabilities. And we can provide a referral to that type of service. Employment counselors help people with regaining the skills that they need to gain employment. So they can help with preparedness for employment, training, like interview skills, resume writing skills, and they can also help with accessibility training you might need. So if you haven't used a computer in a long time, or you don't know how to use a computer since you've lost your vision loss, they offer training like that to get you upskilled into the skills you might need to work. So lots of different referrals that you can receive through a low vision provider and get connected with. We all work as a team together to help make it a comprehensive approach and kind of support the client through navigating their vision loss. Are there any other questions from the audience that we can answer? I'm gonna, then if we don't have other questions at the moment, speak to two other populations that we are pretty adept at serving if this is useful to anybody, their clients or their families. In low vision care, we also provide quite a bit of care for individuals with multiple disabilities. So we are very familiar with examining and providing care for clients that are physically disabled or cognitively disabled in addition to a vision impairment. That sometimes requires specific equipment. And so if you're having difficulty finding care for an individual that's disabled, but not necessarily visually impaired, a low vision provider can typically provide that level of care. We also provide care frequently for people who have had a brain injury or an acquired brain injury from things like strokes, tumors, or brain injuries or head injury. So typically we do see neurological cases as well. And we also see children with cortical visual impairment frequently. So if you're having difficulty finding a provider to assess any of those type of things related to vision impairment, but maybe not necessarily resulting in vision impairment, the low vision provider in your local area would be a good place to start. We are typically familiar with resources for individuals with all types of disabilities. Of course, most familiar with vision loss, but we certainly see plenty of people with multiple disability and would be able to find resources and provide care for an individual living with that. any questions from the audience, feel free to raise your hand or type it in the chat. We're here to answer your questions, and we'd love to hear from you.
I have one more fast question, Dr. Scherer. Is there any kind of lending program for some of these devices? Because sometimes what looks good in the clinic setting is not as good in the day-to-day setting. Is there a way to manage that?
Yes, so there are a couple options, and this is probably going to speak a little bit more specifically to what we do at Chicago Lighthouse. But the Chicago Lighthouse has device loaners if a client needs to try something in their environment to make sure it works for them in their day-to-day. That allows a client to take something home, trial it, and before buying it. We also, our technology team offers rentals of devices. So assistive technology tends to be quite expensive. And they have options to rent a device. So if you just want to try it for a month, again, you could, without the commitment of buying it. The Illinois State also has an assistive technology loaner program. And so your Department of Rehab Services might have something like that where you could loan a device. Because yeah, Mary, you're absolutely right. The devices are very different in our office versus home. I always tell people, like, my office is like the ideal environment. Like, I'm going to adjust the lighting so you're comfortable. I'm going to give you like the boldest text with the highest contrast. So we have to think of being realistic as well, that like the world is not high contrast and maybe not dimmed to your liking. And that can really affect how the devices work when you leave the office.
Well, that leads to another question. Do you try to educate the patients as to what kind of lighting they should use?
Yes, we do. We talk frequently about the use of lighting for contrast enhancement. A lot of our clients have contrast sensitivity loss, and lighting is a functional adaptation for that. We sell quite a few different lamp options that patients are able to get in our retail store at the Lighthouse. I frequently suggest people get a dimmable lamp, because depending on the reading material, your lighting demands sometimes change. And then also there are lamps that you can change the heat setting on them. So like the coloration of the light, it can be cool or warm. And sometimes a lamp with those options can be helpful depending on what you're working on. Sometimes cool light feels brighter, and so some people can't tolerate cool light as much. And then I always recommend people use a gooseneck lamp or something that you can bend, because the closer the light is to the reading material, the better it works. And also the further it is from your eyes, the more comfortable you typically are. So we try to kind of keep it close to the reading material and far from the eyes. So anything that you can adjust is really a great option. But clients also use really functional devices like flashlights or different portable lights that they can always have on hand, which is equally helpful. I'll mention two other things that we do for like light control. So some people have the opposite problem, or they have both issues, whereas some lights are too bright and then sometimes it's too dark. I briefly mentioned that in our low vision exam, we offer tints and filters to help control light sensitivity. That can be in the form of what you would think of like a traditional sunglass. But we typically will do different colored filters because colored tints help with contrast enhancement. And so we typically, based on the disease and based on the person's function, we'll assess a different color and then determine the density of the tint that they might work best with. A lot of my clients use different tints depending on, again, their lighting environment. So they'll have perhaps one for their workplace, one for outside, one for evening or dim settings. So tints can be extremely helpful in terms of light control and also contrast enhancement for clients too. In addition, you can also tint contact lenses. So it's not always in the form of glasses. Some of our clients also wear tinted contacts. I just wanted to point to the chat for everybody. Jesse has posted some of our links to our programs at the Lighthouse. If anything that I mentioned you're interested in learning more about. She also has posted our occupational therapy tips for lighting. So if you want to learn more about what lamps and lighting suggestions an occupational therapist in low vision would have, those are available on our YouTube website if you go to Chicago Lighthouse on YouTube. Any other questions from the audience that we could answer for you? I'll dive into one more thing that a low vision doctor can do for you. We do a lot of driving assessments for individuals with vision impairment. Not to say that everybody qualifies to drive, but we are very familiar with assessing patients for the tool that is permitted as an aid for driving with vision impairment, which is called a bioptic telescope. It's a telescope that's installed into a pair of glasses, and there is a level of vision that would not allow you to drive that with traditional glasses, that you could drive with a bioptic telescope in many states. And so you can look on online to see if your state permits bioptics, but you can also ask a low vision doctor or an eye doctor if you'd be eligible to drive with a telescope. This is typically for clients in the state of Illinois who are 2100 or better. But that varies slightly state by state. So that is another service we can offer in a low vision office. Well, thank you everybody for joining. I want to give you all one more opportunity. If there's other questions we can answer for you.
Well, we do have a question from the audience from Wendy. So Wendy is asking, how does a person with low vision or blind access services from the Chicago Lighthouse?
Great question. If you're interested in quite a few of the services we mentioned, I usually suggest people start with the low vision clinic so that we can understand your level of vision impairment and provide an exam for you. You can call just to schedule an appointment. Our scheduling number is 312-997-3686. Wendy asks, does the person have to live in Illinois? No, they do not, but most of the clients we serve live in Illinois, I would say, but it's not a requirement. We service a lot of people in Northwest Indiana as well, and we do have clients who come from all over. Sometimes the reason is because insurance that people stick to their state. But certainly if you do not have local services, we are happy to service you. We do offer telehealth services in in many of our departments. So if you need a remote service, if you're unable to travel to see us, but you're also welcome to come see us in person. We have locations in Northwest Indiana, in a south suburb of Chicago, in a northwest suburb of Chicago. So if any of those are more convenient, we are scattered around Chicagoland area as well. If there's a more specific service that you're looking for, certainly you can call the clinic and ask for that as well. You do not have to come through the clinic, but that is what the route we recommend. Anything else we can answer for anybody? Our session closes out in about 5 minutes, so we want to make sure that we answer everything that people came here for.
So, Wendy
Go
has another question. Would you be able to refer someone to a low vision clinic in, say, the New England area?
Yes, Wendy, I will be biased and suggest if you're in the Boston area, my alma mater is in Boston and they offer low vision services. I don't know if you're elsewhere and you'd like something more specific, please feel free to let me know. But in Boston, the New England College of Optometry has a clinic and they offer low vision services. If you're not in the Boston area, but you're in Massachusetts Association for the Blind and Visually Impaired would know other services. If you're in another state, I can do a little bit of research for you.
I'm in the Boston area.
Okay.
So your alma mater would be something that I would check out for any clients that I'm with. I'm an occupational therapist as well as, and working with low vision elders. So just curious.
Yeah, New England College of Optometry has clinics, and the major one is in Boston, and they offer low vision rehab. But for pediatrics, they do a lot of services at Perkins and then also Carroll Center for the Blind. But yeah, certainly contact us, even if you are trying to find low vision services elsewhere and you are unsure how to find them. I frequently get messages asking for services across the country, and I can help to look into that for anybody. We understand that low vision services are hard to come by sometimes, and so we want to be a resource to everybody, and that's part of why we are here today. Is there anything else we can answer for the audience? Anything else we can connect you guys to?
Thank you so much, Dr. Scherer, for all your information. There's, wow, a lot to think about and take advantage of.
Thank you, Mary, for being here and helping us with the session. And thank you, Jessica, for moderating. I just want to remind everybody, if you would like to learn more about the intracortical visual prosthesis, the Lighthouse page will have a link to the info session that will be starting at noon today, with information about the clinical trial. I'd encourage everybody to, if you're on the Blind Health Expo today, to explore our page. We have links to a lot of the things we discussed here, and more information about the Chicago Lighthouse and what we offer. The link to the session, the next session at noon, is in the chat if you'd like to join. It will again be starting at 12, so you'll have about 15 minutes for a quick lunch break. Come with your lunch and you can learn about the study that's going on. It's very interesting if you are curious about what's new in the process of cortical prosthesis. The research is developing, and there's been quite a few studies in this space, but we are looking at trying to stimulate vision in the brain for individuals with total vision loss. So we're using an implant in the brain to try to simulate some sort of vision. And so that's what that session will be about. Wonderful. So I'm just going to close out the session and say thank you all for coming, and thank you for joining us. We hope you enjoyed the Blind Health Expo. We hope to be here again every year. And feel free to check out our page to learn more about Chicago Lighthouse. We're at chicagolighthouse.org. And definitely check out Accessible Pharmacy. They are awesome, and we're really grateful for them hosting this expo today too, to bring together all the resources in the world of vision loss. So thank you, and thanks for joining us.